Dr. Robert Murphy, he's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
How are we doing on the capacity for hospital beds as this positivity rate is rising?
Well, so far the Illinois hospitals, it looks like they're able to accept the increased demand. It appears to be spread out a lot more during this peak than in other peaks where there tended to be areas of concentration. So far so good. What has to happen is this peak that we're in has to turn the corner and start going down. Otherwise, we're going to run into the problems that other states are having right now and other countries in Europe are also having at this time.
We've heard a lot about antibodies, whether you remain immune to COVID after you've had it. There's a new immune cell study that they respond after 6 months. Talk about that.
Yeah, so the immune system has two major components. One is the antibodies that everybody pretty much understands. The other is the T cell system. It's a much more specific part of the immune system that goes right after that pathogen, the virus in this case. So they're both very important. And what the study you're referring to, a relatively small study, but they followed the patients out 6 months. And regardless of the antibody response, the T cell response was excellent in essentially everybody.
Oh,
That's a
good.
very good sign. Yeah.
And kudos to all the people volunteering their time to work in the elections, but you say that could be an issue and they should be tested.
Well, Ezekiel Ngozi, the head of the Illinois Department of Public Health, she is recommending that poll workers and anybody that stood in line to vote get tested. That's a lot of people.
Let's talk about CPS saying they're bringing in these HEPA filters in all the classrooms. Do the HEPA filters work? Should people just get one of those for their house?
Well, yeah. Actually, any kind of filter you put in there makes it more difficult for the virus to get through. Nothing's 100%. But if you look at airplanes now who are using these filters, you're not seeing like big outbreaks on airplanes anymore. So any kind of filter or improvement in the ventilation works. And so what CPS did is they went around and tested the air quality in thousands of different rooms, different kind of rooms, classrooms, conference rooms, auditoriums. And they found that over 94% were really had good ventilation. So that's a good sign.
All right, let's get to questions. How do we know that people with positive COVID-19 tests aren't really getting false positives from a seasonal coronavirus cold?
Yeah, this is a great question. You know, a lot of time the seasonal coronaviruses, which do not cause bad disease other than a stuffy nose and stuff, a sore throat, a lot of those people don't really develop much of an antibody response, but they can. All right. And can they help against COVID-19? Maybe a little. We don't really know. The antibodies that that we're measuring now are very specific for COVID-19. So while there can be a little cross-reactivity, probably not very much. So it's pretty much specific.
All right, next question. I received a positive antibody test through the Northwestern study, but the last time I or those around me were sick was back in March. I thought antibodies don't last that long. Was I exposed recently and just didn't infect anybody?
We don't know how long they last, actually.
Yeah.
The studies that have gone out now are the furthest is 6 months. Imagine, this whole disease is like just 8-9 months old. So we don't know how long they last. Maybe they last for years. The one clinical point that's very important is we're not having a whole lot of people come down with a second case of COVID, even when it's rampant like this with, 8-9% of the people getting tested are positive. You know, we're not having a lot of second cases. It's still a handful, literally a handful of cases that have been documented. So they last. They go down though. Now, like with after a measles vaccine or something, they don't go down. So with this, they do drop after the disease, but maybe they just don't go away.
All right, Dr. Murphy, thanks for being. Oh wait, one more question.
One more question. If you recently recovered from COVID-19, how soon can you get a flu shot?
As soon as you're not infectious, which is 7 to 10 days after your symptoms go away, you're no longer considered infectious, and you should go get your flu shot right away.
All right.
Don't wait.
Okay, so if you have another question for the doctor, go to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. He's floating around in the 7 o'clock hour now because of the election coverage, but he's still here. Just wait for him.
My priority.
Thank you.
Thanks, Doctor.
Hey, Paul.
Bye.